Hi and welcome, and thank you so much for joining us today in our series about the dramatic impact of COVID-19 on so many aspects of our MS healthcare. I'm Dominic, an MS reporter, and I've lived with MS for 26 years now. Today, we're incredibly fortunate to be joined by Professor Tjalf from Dresden, Germany. We're going to talk to him about some super important topics, including the much anticipated COVID-19 vaccine and, as infections spike across Europe again, what are the most important actions that your MS team can take? Tjalf, can I ask you to introduce yourself to the MS reporters community, please?
Yeah, my name is Tjalf. I'm heading the MS Center in Dresden, which is one of the biggest academic MS centers. And so we see usually between 1,000 and 1,200 patients, MS patients per month.
Firstly, can you share 2 or 3 best practice examples of how MS healthcare teams in Germany have adapted their approach to implementing MS healthcare? I'm thinking telemedicine, reduced resource because some's being diverted to COVID, as is happening in many places, that kind of thing.
I think the most important thing what we learned is don't panic. Yeah, a lot of centers and a lot of physicians, patients, they have panicked. For example, the German MS Society said that MS patients are risk patients and so on. And that was I'm usually in this situation. I think it's up to us to observe, to look at the data. And now we know that MS patients don't run a specific risk. They have risk factors like normal human beings, so patients without people without multiple sclerosis. And I think that is the most important issue. So if you have a pandemic, don't panic, organize, because a lot of MS centers, they close their doors. We in the COVID time, in the lockdown time, we had even more patients than before because there was a big need for information. And that's my second point. So be close to your patient, provide information. So we give, for example, in our center, we give a monthly podcast to be connected with usually live, with usually 500, 600 patients. That's my second. So don't panic, communicate. And then at the end, really look at the data and organize your center. So of course, a lot of visits can be done as telemedicine visit. A lot of visits cannot be done as telemedicine visit. You cannot apply a medication. You cannot check blood levels. You cannot perform an MRI without being there. And you should concentrate. I think that's my third recommendation is concentrate on the main findings and get the patient in the center in an organized way. And even in COVID times, if everyone is wearing masks, if you have distance in the waiting room, if everything is organized and so you don't have an accumulation of patients, I think it's safe to come to the MS center anyhow. So don't panic, communicate well, and organize well, and concentrate you on the key elements in patient's care.
It's really neat, and we've really seen quite a sort of split. I'm sure you have in Germany from the closed doors to the how can we help.
I think it was the right strategy to be with the patient and don't. So for example, we did not stop any treatments, and we continued our daily care. And I think at the end, I think it was the right decision.
There's an increasing amount of discussion regarding the forthcoming COVID-19 vaccines and the effects they may have both on MS and how they may interact with the drugs used to treat MS. But what evidence or expert opinion is emerging on these topics?
So I think it's a very good question, because we had today the press release about the first vaccine, which showed an excellent response rate and really 90% success rate. So in 90% an infection could be avoided. I think that looks very well, and I think it shows that really an intensive scientific approach to fight against the virus was successful, and I think it's successful. I think it's very easy to understand to go for the health sector first, and then of course to concentrate then on other problematic areas. But of course, MS patients will be part of it. Again, I can only say don't panic. So there are again a lot of physicians, they say, if you go on this treatment, you will not get a immune response and so on. So I hate this type of speculation. I think if you are looking at different vaccination studies in all the drugs we have available, I think it's quite positive. Yeah, so we have no drug without an immune response. Of course, it may vary, but we see from patient to patient it's very. We see the variation of immune response. That's why I think I'm quite positive. If I would look at the previous result now published today, I think the response rate seems to be better than the influenza virus. The influenza virus is a common vaccination in patients with multiple sclerosis, and it works very well. If we have a higher success rate than the influenza virus, I think it's very positive. We should take into account that everything will take time. So until we have the official approval, until vaccines will be ready, but I hope that life will normalize next year. And so for me, looking at this data, I would not enter the chorus of saying that some treatments will not allow successful vaccination. I think it's a very robust immune response what we see, and I think it will solve the problem of COVID-19. Now it's of course a challenge how to organize it, and of course it will be a vaccination where the whole world will be vaccinated, and that's really an infrastructural challenge. And there, of course, now politicians should now think about how this should be organized. I think successful vaccination is not enough, so it should now be planned. And I think the MS centers would be an ideal situation, at least in Germany, to provide vaccinations in a coordinated manner.
As the infections rise again across Europe, as was predicted, what do you think are probably the most important actions that the MS healthcare professionals can take in light of what we've learned so far? So this is really looking forward.
Give the recommendations, really educate your patients. We should take care of keeping these general recommendations. We have to understand them and we have to keep them until we have a solution with the vaccination. So again, to remember that COVID-19 is not a serious disease for MS patients in general, but the big problem is it's really like a surprise present. So we don't know. So what will be individual outcomes? So even young patients, they can show severe causes, but especially, of course, for all MS patients or for MS patients with other comorbidities, of course, there is a significant risk, and that's why we should take action. So keep contact with the patient. Of course, we can think about how we could make management of MS more straightforward, how we could avoid personal consultations, and so on. That's why no general rules. Don't get all of your patients out of the center. So I think we should continue with a certain management, and I think then we can cope this pandemic. We have really to be cautious, to practice distancing, to avoid contacts, and then I think now we have the light at the end of the tunnel with the vaccination. But until this is available and until we have reached a certain level of immunity, I think we have to be cautious.
Thanks so much for watching, everyone. You're all a pretty social media savvy bunch, so you know how important it is for Shift MS that you like, subscribe, tweet, and share our videos. You all know the drill. It's really, really important for us as a charity. Take care, stay safe. We'll see you again really soon. Thanks.